My name is Bibi. I live in Southern California. I have been struggling with chronic pain for the last 15 years of my life.
Her ability to just move around the house, to walk up and down the stairs, really disappeared.
Bibi came to see me after she had seen several other pain doctors in the area. As it turned out, she had actually already undergone another trial with a different type of spinal cord stimulator and had been implanted with that stimulator by the time that I met her. She had ultimately failed that device, was not getting relief.
It was very clear to me that my previous stimulator did not have the same ability to do the things that I needed to do as a patient to improve the quality of my life. Number one, it didn't have the ability to remotely monitor the way Prospera and the Embrace One team does. And so there is always this delay, no relief. Prospera was very different from that.
The Embrace One care team is the group of people who are responsible for taking care of my patients. There are our local reps who are part of the team, but there are also folks who are working remotely and monitoring all the different aspects about the Prospera system once it's been implanted.
Our job is to monitor the patient's devices, manage what's happening with the device on a daily basis, and if there's any type of notifications that are happening.
So those folks are working to monitor the patient's charging habits, the programs they're using, the intensity of stimulation they're using to be able to combat any issues that should arise.
What's really unique about the Embrace Care team is that we are available to remotely monitor the patient's device 24 hours a day, 7 days a week, 365 days a year. So we're there whenever they need us.
For example, last week, I accidentally turned off my therapy. Lindsay called and said, I think there's something wrong.
She didn't notice, but I did. Let's get it back on and get you back into therapy and out of pain. We can also remote program patients, so they can be in the comfort of their home, and we can do it within minutes.
The other part that I really have enjoyed about the Prospera system is the fact that I can use the portal to monitor all of my patients. This has allowed me to keep track of all of my patients from start to finish throughout all the different phases of care.
This entire Embrace platform, it's a partnership between the rep, the Embrace Care team, and the physician to really manage and care for the patient. It's really nice because it's never been done before.
Historically, I was in charge of kind of keeping everybody afloat and aligned, and it created a lot of extra legwork in the office. So the fact that now somebody is keeping an eye on these things and gets a handle on them before they turn into a huge issue, or before the patient loses confidence in the therapy, loses confidence in me, or thinks this is just as good as it gets, someone is attacking those problems and taking care of them. I've been really impressed with the speed with which things are dealt with, and then also the amount of calls that have not come my way as a result of the Embrace One portal.
The reality for me is that because Embrace One is looking out for me, I can go about the business of living my life. I don't have to be the guardian of my therapy.
It seems like it's the right thing to do for patients and for physicians, because these are patients that we've really invested in and patients that are very invested in their care, and there just really isn't anything else comparable out there.
For the first time, I feel as if I'm living the life I was meant to be.